The retiree suffers from age-related macular degeneration, or AMD. It can lead to a severe loss of vision. Fluid is collecting in his eyes and is slowly destroying his eyesight.
The worst-case scenario doesn't bear thinking about.
But one day, all of a sudden, his vision started to deteriorate.
3 years ago, I really started to notice that my eyesight was failing. This test involves taking a piece of paper with a grid and covering one eye at a time. You look at it and see whether all the lines are running parallel or whether they look wavy. If they are wavy, it's a clear sign that something is wrong. The problem is that if it isn't treated quickly, it can lead to a loss of vision, and that is awful.
What's awful about the disease is that many patients suffer an extreme loss of vision, even if they do get treatment. Oskar Zlamala hopes to avoid that by going for regular checkups at Vienna General Hospital. And patients like Oskar Zlamala regularly get a drug injected directly into their eyes. But it's unpleasant and doesn't work well for everyone.
We want to carry out as many of these injections as necessary, but as few as possible. Each injection into the eye hurts and carries the risk of infection. Medication is also expensive.
It often costs €1,000 per injection. That's why the doctors in Vienna want to take a closer look at Oskar Zlamala's eyes. An imaging procedure is used to give a cross-section view of the eye and retina. It lets the doctors better assess the extent of the disease.
In this case, fluid is gathering under the retina, which is lifting it up.
So Professor Schmidt-Erfurt decided to design a program that can do just that. It was fed with the data of many other patients with the same condition, and it can tell exactly how much fluid pools under the retina, in blue here. The program allows Oskar Zlamala's treatment to be tailored.
Knowing how this treatment works has given me a whole different perspective on things. Personally, I feel much more reassured.
AI can potentially make diagnostic detective work easier, keep medical costs down, and, most importantly, reduce human suffering.